Hi there, how have you been? What's been going on lately?
I don't know. I just feel like something's off. Maybe I'm just overthinking, but a few things happened recently, and I don't know. I keep wondering if there's something wrong with me. Lately at work, I've been struggling to focus. I sit in front of my computer for hours, and it's like nothing gets done. The work just keeps piling up. I don't even have time to think. One time during a meeting, I just felt dizzy, like I couldn't breathe.
And after that, have you tried doing anything to adjust or manage how you're feeling?
I've tried, but the work doesn't stop. And when I finally leave the office, I just get pulled into one thing after another. Dinners, drinks, smiling for hours. It's too much. I feel like I'm running on empty. Every time I'm at these dinners, I feel like I'm stuck there. Even when I'm exhausted, I have to keep smiling, keep the energy going. And when work calls, I can't just ignore it. I have to deal with it, no matter what.
What does that feel like for you? Is it just tiring or does it make you feel trapped?
Sometimes it feels like there's a weight pressing on my chest, making it hard to breathe. But I can't say no to them. I'm afraid they'll think I'm being antisocial.
That pressure in your chest, does it feel physical or emotional? Like a response to stress or something more?
I don't know if it's physical or emotional. It feels like both. It's not just when I'm out at dinners. Even something as simple as grocery shopping makes me dizzy. My chest tightens, my breath gets shallow, my mind spirals, and I feel like I can't even relax in my own space anymore.
Have you gone to a hospital for a checkup? Sometimes physical symptoms can overlap with what we're experiencing emotionally.
Yes, I've had checkups, heart tests, brain scans, everything. They all came back normal. The doctors said I was fine, but it doesn't feel fine.
It sounds like you feel tense, not only at work, but also in your daily life. Have you had more similar experiences recently?
Yes, there was one time on the subway. It was particularly intense. That day on the subway, it hit me out of nowhere. My chest felt like it was being crushed, and breathing got harder and harder. The world around me started to blur. My hands were shaking, my legs felt weak, and I thought I was going to collapse. I tried to grab my phone, but I couldn't even dial a number. It was terrifying. Just when I thought I couldn't hold on any longer, a stranger noticed me and rushed over. He grabbed my arm to keep me from falling. He called for help and even alerted the subway operator. The subway came to a stop and everyone moved aside to make room for the medics. In the ambulance, I thought I was dying. My chest was so tight, my breath so shallow, I couldn't think straight. Then the medic came in, spoke softly, and it somehow helped calm me down. But all tests came back normal, an ECG, a CT scan, everything. The doctor said it was all stress, but it felt so real, like my body was completely out of control.
It sounds like that experience must have been very frightening for you. Many people, when they experience this for the first time, think it's a heart attack or some acute medical condition. But actually, it might have been a panic attack. Have you heard of panic disorder?
Panic disorder? Isn't that a very serious mental illness?
Not at all. Panic disorder is a type of anxiety disorder characterized by recurring panic attacks.
I thought it only happened when someone was overly nervous, but I'm not exactly a particularly anxious person.
That's a common misunderstanding. Panic disorder isn't just normal nervousness or anxiety. It's a combination of psychological and physiological responses. Your body mistakenly believes you're in danger, triggering a fight or flight response. This can lead to a sudden rapid heartbeat, chest tightness, difficulty breathing, and even a feeling of impending doom.
So, it's just my body making a mistake. But why does this happen so suddenly? I wasn't in any real danger that day.
That's a great question. Panic attacks can have various causes, such as stress, lack of sleep, overwork, or even subtle triggers in daily life. Sometimes the reason isn't obvious. For example, accumulated work stress or unprocessed emotions can suddenly erupt at an unexpected moment. Essentially, your body misinterprets these signals as life-threatening, leading to the intense physical reactions you experienced.
So, what I went through wasn't a fatal condition, but just my body giving me a false alarm?
Exactly. And the good news is that panic disorder isn't something to fear. There are effective ways to manage or even prevent attacks, such as breathing exercises and identifying triggers. Together, we'll explore these techniques and help you uncover potential trigger.
Doctor, what should I do if this happens again? What if it's like that day and I can't control myself? Could it get worse?
That's a common worry, especially after a panic attack. Don't worry, we'll take it step by step. First, when you feel the symptoms coming on, try adjusting your breath. This is the most direct and effective way to regain control. Imagine your breath is like a balloon. When you breathe in, the balloon slowly inflates, and as you breathe out, it gently deflates.
Does breathing really help? I tried deep breathing that day, but I still felt like I couldn't catch my breath.
The key is not just deep breathing, but slow, rhythmic breathing. When we're in a panic attack, we tend to breathe too fast, which throws off our carbon dioxide levels and makes dizziness, heart palpitations, and other symptoms worse. Try this. Breathe in for a count of 4, hold your breath for 4, and then exhale slowly for 4. This is the 4-4-4 breathing technique.
I'll try that, but is it really going to work? What if I panic again?
Remember, panic attacks are temporary. The more you practice these techniques, the better you'll be able to control them in the future. It's all about retraining your body's response. Don't worry, you'll get better with time. And if you ever feel overwhelmed, just take a moment to breathe, reset, and you'll regain control. Remember, this breathing exercise can help calm you during an episode, but it's also a great daily practice to build your body's resilience.
That sounds simple, but I feel like the fear isn't just physical. It's like my brain is scaring me too.
You're absolutely right. During a panic attack, your brain tends to misinterpret harmless signals as dangerous warnings. Here's a small exercise called cognitive restructuring. When you feel scared, ask yourself 3 questions. What is really happening right now? What's the worst that could happen? And will it actually happen? This helps you step out of fear and see things in a new light.
That makes sense. So it's about challenging my thoughts and not letting fear take over?
That's exactly right. The more you practice this, the more confident you'll feel in facing these situations. Once you've calmed your body, you can begin to calm your mind. For example, that day on the subway, your brain might have thought, "I'm dying." But if we look at it differently, you could tell yourself, "This is just my body overreacting. The symptoms will pass soon." Try turning fear into concrete facts instead of letting it grow. That's exactly why we need to identify and address triggers. Panic attacks don't come out of nowhere. Often they're caused by underlying factors like fatigue, lack of sleep, or even unpleasant memories. Together, we can figure out your triggers and create a plan to manage them.
I guess that makes sense. Sometimes I do notice I'm more on edge when I've had a rough night or when I'm overworked.
Exactly. Recognizing these patterns is the first step. Once we know your triggers, we can build a plan to help you feel more in control when those moments come up.
That sounds like something I can work on. It feels good to know I don't have to face this alone.
We've talked about adjusting your breathing, reframing your thoughts, and identifying triggers. Another powerful tool is redirecting your attention. This can be especially helpful when you feel those first signs of panic creeping in. It's like pulling yourself back from the edge. For example, when you sense panic coming on, try focusing on your surroundings. Look for 5 things you can see, 4 things you can hear, 3 things you can touch with different textures. This is called the 5-4-3-2-1 senses technique. It shifts your focus from your inner feelings to the external world, grounding you in the present.
That sounds doable. I will try.
Yes, just try it. Small actions like this can anchor you to the present moment. The more you practice, the easier it will be to ground yourself when panic arises.
These methods sound practical. I'll try them. But can I ever completely get rid of it?
If you maintain a healthy routine and develop positive thinking habits, the symptoms will lessen significantly. When you learn to coexist with it, instead of fearing it, it becomes like a shadow present, but powerless.
So, it's not about defeating panic, but learning to live peacefully with it.
That's right. When you stop seeing it as a terrifying enemy, it loses its power over you.
Then, what if none of these methods work? Does that mean there's nothing left for me?
It's completely normal to feel that way. But no, it doesn't mean we're out of options. Treating panic disorder is never a one-size-fits-all approach. If something isn't working, we can always explore other possibilities together.
Other possibilities? Like what?
Let's start with medications. Beyond common antidepressants or anti-anxiety medications, there are alternatives like SRIs, selective serotonin, and norepinephrine reuptake inhibitors. Some patients respond better to these, as they target specific pathways in your brain to help stabilize your mood.
What if medications really don't work for me?
That's okay. In such cases, we can look into non-medication treatments. For instance, have you heard of TMS?
No, I haven't.
TMS stands for transcranial magnetic stimulation. It's a non-invasive therapy that uses magnetic fields to stimulate specific regions of your brain and help regulate emotions. It's often used for patients who don't respond well to medications.
That sounds advanced, but is it better than medication?
It depends on the individual. For some people, it can be a game changer. And if we find that your symptoms are tied to past trauma or specific triggers, there's another option: EMDR.
EMDR?
Eye movement, desensitization, and reprocessing. It's a therapy that helps you reprocess memories and emotions tied to panic attacks by guiding your eye movements. It's especially helpful for patients whose panic symptoms stem from past trauma.
These options sound interesting, but do they take a long time to show results?
Some do, but there are quicker methods like biofeedback. It's a technique where you learn to control your physiological responses, like heart rate and breathing, in real time.
It seems like there are so many options, but if my symptoms are really severe and affecting my life, would these still be enough?
In that case, we might consider more intensive treatments, like short-term inpatient care. In such an environment, you'd receive 24/7 support and a highly personalized plan to help you regain control more quickly. Panic disorder can absolutely be managed. It just takes time and patience. If what we've tried so far isn't working, don't worry. There are still plenty of options, and I'm confident we'll find what works for you.
Thank you. I feel a lot better knowing that. I'll give those techniques a try when I get home. Hopefully they'll help.
Great. Remember, progress takes time. Don't rush it. Every panic attack can be a chance to practice, even if it's tough in the moment. You're stronger than you think.
Thank you. I'll keep that in mind.
And if you run into any challenges, just let me know. We can talk about it during your next session.
Thank you so much. I'll do my best.
Before we finish, let me ask, have you ever dealt with something like panic attacks? Or maybe you're going through it right now? Feel free to share your story in the comments. Who knows? Your experience might be just what someone else needs to feel a little less alone. Thanks for watching today's video. If you found it helpful, give it a like and don't forget to subscribe. We've got more mental health topics coming up, so stay tuned. Take care of yourself, and I'll see you next time.